back to Ageless Living, where you are able to learn about beauty, health, fitness, and just overall well-being. And this is Kurt Wilhelm, the co-host here on Ageless Living, and Dr. Lee, the founder of the show. We appreciate you tuning into our show, and we are going to be picking up where we left off before the break. And we're going to be talking about Steve Jobs and the lead-in to the whole integrative medicine concept and the controversy surrounding that. So obviously that stirred up a lot of controversy, especially recently when Steve Jobs confessed that he wished that he had taken a more integrative approach, that he actually had not removed modern medicine's cancer treatments and surgery. So how would you address that? If you had been his physician, you weren't, of course, but if you had been his physician, what would you have recommended?
Well, there's no doubt there are many different types of pancreatic cancer. Some of them have better prognosis than others, and I don't have all the detailed information, but it appears that he had the one that's less aggressive had a better chance of longer survival. So his physician recommended surgery and possibly chemotherapy and other modalities in addition to that. And at the time, he didn't feel like to have his body cut open. I didn't want to lose that kind of integrity and respect to himself. He opted for alternative medicine for 9 months. Well, Kurt, would you do that?
No, because I believe in integrative medicine. However, if I could give a little bit of credence to what he was.
Well, as a smart person as he is, I don't think that's a very good choice.
No, I agree. Integrative would be more important.
If I were him, I would have probably do both.
Yes.
So to blame alternative medicine as the reason he died, I think it's a little bit misleading. I think it's his choice, his decision.
It's not what he did, it's what he didn't do.
That's correct.
And I think that's the point that we want to make, is that it wasn't that there was quackery, because I mean there are a lot of people who go through chemotherapy and then guess what? They die. Does that mean they committed suicide because they didn't go to the holistic doctor?
Did it happen because of the chemotherapy was fake? No.
Right.
But no, nothing is 100%. That's the other point of we were trying to touch. Is it magically healing? It's not magic.
Right.
But it is healing.
Sure.
Many surgeries or even just medication therapies are 40 to 60 to 70% effective. They're not 100% effective.
Correct. And chemotherapy is not 100% effective.
Absolutely not. Yeah. One simple example is antihistamine for allergies. They don't always work. But does that mean that it doesn't work at all? No, that's not the case.
Correct.
It just doesn't work 100% of the time on 100% of people.
Absolutely. So if he had been trying holistic medicine for a while and it was still progressing, at that point he should say, okay, let's try the more aggressive therapies.
He went on, I think 7 or 9 months later and had surgery, and the commentary was saying, well, it was too late. It may be. He did survive 8 years since the diagnosis of cancer. If you look at the statistics of pancreatic cancer or any cancer, we're talking about 5-year survivals.
Interesting.
So
that's why we have a physician here on the show.
For pancreatic cancer, the average survival is we're talking about 30, 40 to 80%, depending on different types.
Sure. For
5 years. So he's not really out of the curve of the normal distribution of pancreatic cancer.
Sure.
I mean, you can argue that his type of cancer is a relatively better have better prognosis. So that's an individual case.
Absolutely.
Yeah.
And if we look at kind of what modern medicine says versus what your holistic practitioners say about the treatment of cancer, modern medicine with chemotherapy is basically saying, hey, we have something that is out of line. We have some crazy cells that have gone nuts, and they're recruiting other cells to go crazy along with them. It's a very easy way to say that. So the idea of chemotherapy is that you're going to go in there and kill the crazy cells. Well, the problem is, in order for you to kill the crazy cells, you're actually killing a lot of healthy cells at the same time. That's why you become so sick. So that's what the modern medicine is saying. Then you have the holistic side, which is saying, you know what, let's move toward health. Let's help your body fight the cancer in the normal way an immune system normally would.
For example, you can describe this in a war.
Uh-huh.
You can either use the Western medicine or chemotherapy or the surgery as more advanced weaponry to kill your enemy.
Right.
Or you can use the alternative medicine to build your army to be stronger.
That is a great example.
There are two ways of winning the war.
Almost like a nuclear bomb. I mean, chemotherapy is similar to dropping a nuclear bomb on an area that you're trying to kill, but all the fallout ends up hurting your body. Now, we're not saying it's radiation, even though radiation therapy is, we actually do have radiation therapy, right? But that's an analogy. Now, moving toward the holistic side, like you say, you're actually recruiting the battalions of your immune system to actually go out there and fight those cancer cells. And so what is wrong with having trying to make your body more healthy and also using the modern medicines methods?
Well, that's what I would choose.
Absolutely.
Both.
Yeah.
Life is too short.
You got to try it all, and especially if your life is maybe given 3 to 6 months, I think, or 9 months. I think it's time to try it all.
In terms of 5-year survival, so.
Absolutely. The other advantage to holistic medicine, even though that isn't exactly the case, because holistic practitioners can also become a little bit expensive when it comes to cancer. But I mean, we're talking $16,000 to $18,000 that you might utilize during a 9-month period of fighting cancer with a holistic clinic, versus hundreds of thousands.
Well,
on the other
I'm
side.
not an expert in that field, so I'm not going to, jump into that. But I think the cost in holistic medicine is in general lower.
Correct. And that might mean more out of pocket because it's not necessarily covered by insurance. But if it's your life at stake, $16,000 to $18,000. I'm not in any way trying to sell you anybody who has cancer on the idea. But if you're putting everything that you own into surviving, you might as well try both. That's the message we're trying to get across. And so now moving more to the overall, we use Steve Jobs as an example, but the point is that when we argue back and forth, where is there quackery, where is there not quackery? Well, in modern medicine, that even though there's a very quantitative approach, there's also the downsides as well. So when we are out there, all of you tune into television, many of you, most of you tune into television, and when you hear the pharmaceuticals that are advertised, very, very often, the side effects that at least we have to have them listed on a commercial, but if you listen to those side effects, some of them include death. And so it sounds to me like, if one of the side effects is death, then why not try a holistic practitioner's approach where maybe the side effect would be you're a little bit more healthy when you're done.
That's true. I do want to point out the herbal remedies do have risk too.
You bet. Those are some of the dangers we might want to talk about too.
Yes, some of the Western medicine actually were developed from herbs. Some
true.
of the heart disease medicine and some of the antibiotics that were extracted from plants. So just because it's herbal medicine doesn't mean it's always 100% toxic free. So
really
be
true.
aware of that.
Like red rice yeast, there's a lot of pharmaceuticals that are use the red rice yeast as a base for lowering cholesterol. Now, speaking of, Dr. Lee is going to be sharing here at the end of the next break, or at the end of the next segment, some great ways to reduce your cholesterol. Again, consult your physician, but we would love to have feedback, whether you email or call into the show, to be able to, when we give these ideas, once you've consulted your physician and actually feel that you want to try these, we'd love to have feedback from our listeners as well.
Absolutely. So we're talking about it. Does it work, the alternative medicine? Well, you guys are the best judge. You guys know the best. Over 50% of population in developed countries, such as Germany, UK, America, that many people use alternative medicine. They use it on their kids. 10% of them.
Mhm.
What does that tell you? I mean, we know from ancient time, from our own experiences, that hey, some of it works, and to a degree,
Mhm.
just like all other medication.
You bet. So in everything that we do, if anybody is ever trying to interpret the discussion between Dr. Lee and I, and what the message we're trying to get across is that we never want you to remove yourself from your physician and the advice your physician is giving. However, we want you to integrate in, that's why we call it integrative medicine, the complementary side, to make sure that you are adding the complementary sciences of good nutrition, and holistic science, and it is a science, and that there's a lot of quantitative research. So when we come back from break, we're actually going to be talking about acupuncture, and some of the quantitative analysis. There's a reason why acupuncture has stayed around for almost millennia.
Thousands of years.
Yeah, thousands of years. And there's a reason why it's still here, is it actually works. But it's nice to be able to have some quantitative research about which parts of acupuncture work and where it works best. And Dr. Lee is an acupuncturist as well. So when we come back from break, we're going to be talking more about that. So don't go away. This is Kurt Wilhelm, the co-host of Ageless Living, joined by
Dr. Tong Lee.
Here on Ageless Living on Voice America. Thanks so much for joining us. We'll be right back after the break.